name is Ben Sopkin. I'm the specialty care manager here at Osceola Medical Center. I'm joined today by Robert Seiberlich, rehab manager at Osceola Medical Center. How are you doing this morning?
I'm doing well. How are you, Ben?
I'm great, thanks. So this month, October, is Bone and Joint Health Month. So we want to put together a series to sort of ask some questions regarding this. So one of the questions a lot of people have is, why do my joints make popping or cracking noises?
Yeah, that's a great question. And a lot of times people ask why that's happening too. And I think it's important to know right away that most of the time it's totally normal and safe for your joints to make different noises. And really there's three main reasons why this happens. The first reason you can kind of think of when people are cracking their knuckles or cracking their back or their neck. And that what happens there is you have some fluid within your joints, and that fluid acts as kind of a lubricant so your joints can move freely together. Inside that fluid you have different gases, and sometimes if you're not really moving a whole lot, you can get pockets or bubbles of gas in the joint that can get sort of stuck in there. And then when you move a joint in a certain way, like if you're cracking a knuckle, that gas can escape out of the joint really quickly, and that's when you get that nice crisp pop or kind of satisfying crack. The second reason why that can happen sometimes is like if you're doing something repetitive. So if you've got a job where you're doing the same task over and over again, or if you're working out at the gym and you're doing a certain number of reps of an exercise, sometimes you can feel or hear a consistent snapping noise coming from a joint. And that's usually caused by either a tight muscle or a weak muscle. All of our muscles attach to different points on our bones all around our joints. And our bones have different bony structures or things that the muscles attach to. And so sometimes the muscle can travel or snap across those bony structures, and that's when you can experience some of that. And the third reason why this is kind of more age-related. As we age, the cushion that's between our joints can wear down, and a lot of times that's referred to as cartilage. That cushion acts as a shock absorber and also as sort of a lubricant for our joints. And so as that cartilage or that cushion breaks down, the bones can start to rub together, and it takes this nice smooth surface of our joint and it wears it down to a point where it's a little bit more rough and clunky, and that can start to produce some noise too. So when you hear people talk about having arthritis or bone on bone, that's usually the process that's going on inside of your joints.
So great explanation. It's nice to see there's different reasons why. So we think about, when does it become to the point where you should go in and see your doctor? You know, when do we know between those three things when it's serious enough to say, hey, I should go visit someone?
Yeah, there's really a couple of reasons that might prompt you to do that. The first one is if the noises, the popping, the clunking are starting to be accompanied by pain and swelling. That would be one occasion where I would recommend you go and see your provider. If there's been something like an injury or something traumatic to a joint, where all of a sudden it's starting to make more noise or louder noise, I would recommend talking to your doctor about that too. And then the last thing would be if these noises or pain in a joint is starting to interfere with your normal things that you have to do or like to do during the day. If it's getting in the way of those things, then I would definitely, again, bring that up to your doctor.
Well, I appreciate your time, Robert. Thank you so much. And thank you so much for visiting this series, and have a wonderful day.